So men, tell me, why do you not like checking your blood pressure? Blood pressure, as we know, if it's very high, can lead to health conditions such as strokes, diabetes, even blindness in the eye. You can lose, sensation in your arms and legs, loss of arterial and venous diseases, and several other health conditions, including kidney damage. So it is very important to check your blood pressure. In terms of normal blood pressure range, you want to aim for 135/85, but anything less than 140/90 is acceptable. Now, a lot of men would say, Doctor, I don't feel unhealthy, I feel okay, there's nothing wrong with me, I don't think I need to check my blood pressure. However, you have to understand that there are processes going on in the background of your body where basically if your pressure is being pumped at a continuous high rate, your heart cannot cope with the demands of this high blood pressure. So if you imagine a pipe, like a pipe that's got lots of water, and this pipe is continually pumping water at high pressure, eventually the pipe will burst. And that's similar to your heart. So the way your heart tries to compensate is to increase the heart muscle. So the heart muscle now enlarges, known as muscle hypertrophy. So you now have an enlarged heart because your heart is trying to cope with the demands of the high blood pressure. And what happens with an enlarged heart is eventually the heart muscle stops working properly. And this can lead to causes like heart attacks, where basically not enough blood is being pumped to the vessels of the body, and so therefore not enough oxygen is returning back to the heart. Also, this can lead to heart failure because your heart can no longer function well enough. The left ventricular chamber is not able to pump the amount of blood that it needs to other parts of the body, and that is heart failure. So what results with that is that you become short of breath, you become fatigued, you now have swelling in different parts of your body. Then we've also talked about strokes. High blood pressure continually also means lack of blood flow and oxygen to the brain, which can lead to strokes. Again, your kidneys get damaged. If you have other comorbidities like diabetes, high cholesterol, thyroid problems, these are all linked. As you know, there are risk factors for blood pressure. So for example, if you've got a family history of high blood pressure, then you're more likely to have high blood pressure. If you do not exercise, men, it is very important to exercise. What exercising are you doing? Do you go for walks? Do you go running? It is important to do some form of physical activity. And if you smoke, stop smoking, because smoking is not good for your lungs. It's also not good for your arteries. Also, alcohol. Alcohol is another factor that can increase blood pressure. Eating fatty foods, the wrong sort of foods, have more of a Mediterranean diet, a low salt diet to reduce your blood pressure. So other factors that you cannot control might be underlying health conditions like if you had type 1 or type 2 diabetes, if you had, a thyroid problem, if you had an autoimmune health condition that might cause high blood pressure. So, most men would say they haven't been to the doctors for a checkup for a long time because they don't feel the need to, or they don't have time to because of work. Men, make time. Your health comes first. Your health is more important than making all that money, because if you make all that money, you have a stroke. Who is there to spend all that money that you spent making, from 8 o'clock in the morning to 11 o'clock at night? You have to reevaluate your life and know that it's simply not worth it. Your health is more important than making that money. That money goes away just like that, and equally you can make the money just like that. So especially with black men, black men, I find out of all the races are the most stubborn. Black men will say, I don't need to go to doctors at all. I don't need to check my blood pressure. I'm fine. Black men, you need to tell me, is this a cultural thing? Is this a pride thing? Because I cannot relate as a black person why you would not want to check your blood pressure. I know I'm a doctor, but I've got my own blood pressure machine and I check my blood pressure once in a while to make sure that it's okay. So my blood pressure is normal, it's within range. Men, if you don't want to go to the doctor, fine. Buy yourself a blood pressure machine, check it at home. Do this for 7 days, morning and evening. Check out the average. If it's anything above 135/85, or if you want to go for the higher range, which is above 140/90, then speak to your GP so that they can decide if you need any further tests or investigations. Or for you men, if it's over 160/100, then you might be someone that needs to go on blood pressure tablets. Now, there are different types of blood pressure tablets, so they have to find out the suitable blood pressure tablet for you. Some black people are unable to take certain blood pressure tablets such as Ramipril because they lack the renin enzyme for which the ramipril needs to work. So if you're taking blood pressure tablets and your blood pressure is not coming down, then you need to speak to your doctor. So men, please make sure you check your blood pressure to prevent any risk of any cardiovascular or cerebrovascular events such as heart attacks, heart failures, strokes, kidney problems, worsening of your diabetes, blindness of your eye, numbness of your hands and feet, because your blood pressure can cause all these problems. Now, I hope you enjoyed this video.